cardiac function, and hemodynamics improves after drainage of large volume pleural effusion. Previous studies have reported that pleural effusion results in circulatory instability and hemodynamic compromise through a mechanism similar to cardiac tamponade. By understanding exactly when the hemodynamic change is most noticeable, can explain the effect of drainage on the cardiovascular system, and help illustrate the resulting dyspnea relief. The study goal was to evaluate the effects of drainage of large volume PE in cardiac function changes with respect to time, and to compare the hemodynamic measurements between PE on different sides of the thorax. Subjects with symptomatic PE secondary to non-cardiac etiology requiring pleural drainage were enrolled in the study. Patients who did not undergo drainage within 1 month before admission were included in the study. Patients who had physical weakness were excluded from the study, as it would make drainage difficult to endure. Subjects with pericardial effusion were not included, because the pericardial effusion may have confounded the results. A sum of 47 patients who met the inclusion criteria were included in the study. All the patients underwent transthoracic echocardiography evaluation before the drainage procedure, immediately after, and 24 hours after the procedure. Significant improvements were seen in ventricular end diastolic volume index, left atrial volume index, right ventricular area, right atrial area immediately after drainage and 24 hours after drainage. The left ventricular ejection fraction, fractional area change, right ventricular free wall strain, increased, and ratio of early transmitral flow velocity to diastolic mitral annular velocity decreased significantly in patients with pleural effusion in the left side. Significant improvements were noted in right atrial area and global left ventricular strain after drainage in right-sided pleural effusion patients. The study results infer that improved cardiac preload and systolic function with considerable improvement in diastolic function is essential for hemodynamic changes after large PE volume draining. The study also indicated that improved cardiac hemodynamics are a considerable contributor to the underlying mechanisms causing dyspnea in PE patients.